just to begin, would you kindly share a bit more about yourself and what has influenced your career and leadership journey up to this point?
Well, thank you very much for having me on this webinar today. You have actually said much about me from the brief citation that you just read out. I am a medical doctor, a co-cancer advocate of over 25 years, and currently the president of the Nigerian Cancer Society, as highlighted earlier by the moderator. From Yobe State, northeastern Nigeria. Cancer advocacy is what I know how to do best. I have been a cancer advocate right from my university days when I joined the Nigerian Cancer Society during my second year in medical school. And I have not relented ever since. I saw to the establishment of the Nigerian Cancer Society branch at Federal Medical Center in Nguru, and then at a later stage, the establishment of the Nigerian Cancer Society branch in Yobe State. And I have been a national advocate throughout my years of medical practice. And this is the result of that consistency that made it possible for me to be the president today, having superintended as the vice president to my predecessor, the immediate past president of the Nigerian Cancer Society, Professor Sani Abubakar Malami, the former Commissioner of Health in Bauchi State, a professor of pathology. Having served under him as vice president for 2 years, he saw the wisdom in having a trajectory of producing future leaders of the society that are co-advocates, public health physicians, co-advocates that have the zeal and the energy to make inroads and unify the society better. And by the grace and power of God, this is October, I was elected as the president of the society in the year 2020, precisely on October 28th. And by October 28th this year, I will be 1 year in office. And thanks to the wise wisdom of my predecessor, I am now in charge of the Nigerian Cancer Society. And truth be told, the entire architecture of cancer advocacy in Nigeria is right behind us. I have been receiving tremendous goodwill on the part of cancer advocates across the country and beyond. We have cancer-related organizations that are based abroad coming forward to identify with the Nigerian Cancer Society and making commitments towards the growth of the society, because we have all come to a common understanding that we need to be together, we need to come together, put our acts together, put all hands and feet, according to my extension, on deck towards advancing the cause of cancer care. And we thank God, the voices we are making I get into the appropriate quarters, I get into the appropriate authorities. And by the grace of God, we are not relenting. We are not going to stop halfway. We will ensure that we take it one step at a time. And, the ultimate key is universal health coverage for all cancer patients across the country, across Africa, and all over the world, which is achievable and doable. So this is the little I have to say on my, activism as an advocate and the belief in being positive, looking ahead, and creating a trajectory of a successful impact to the society. Thank you very much.
Thank you, Dr. Omar. That was quite a wonderful summary of your journey so far, and I think it's quite notable when you mentioned Professor Malami. I quite agree with you on that front of his amazing leadership, being a seasoned leadership expert. And I just want to say congratulations on your first year in office. Well done.
Thank you. Thank you.
You're welcome. My next question will be, so far, breast cancer is reported to be the most common female malignant disorder and leading cause of death. Last year alone, reports show us that over 2 million cases of breast cancer was recorded globally, according to the World Health Organization. Can you explain what are the common barriers to preventive care and why they continue to exist?
Well, you see, when you look at the burden of breast cancer across the world, you will discover that, breast cancer is actually commoner in whites as opposed to blacks. But in whites, most cancers, not only breast cancer, have a very positive outcome in the sense that have a very good prognostic outcome. Why? Because early detection is actually the bedrock of being treated. Breast cancer, when detected very early, can completely be cured. In the African society, we have a multifaceted, and very complex situation whereby the awareness that will serve as the ladder to early detection is lacking in most of our society. When taking Nigeria as an example, where you have the percentage of the population that are living in the rural areas, over 49%, and you have another 50% of the population living below the poverty line. You will have a situation whereby the primary target is how to survive. The primary target of most of the individuals in the society is how to eat and survive. So you have a situation whereby health-seeking behavior is usually neglected. It's usually, relegated to the background. And people don't go out of their way to seek for medical attention, talk less of having to get the knowledge of self-breast examination. So you discover that there are a lot of myths and misconceptions going around. When you come from an environment like mine, in the northeastern part of Nigeria, where there is very high level of illiteracy, there is very low, very high level of poverty, the poverty index, being very high. You discover that people are not informed. People are not educated to that extent of getting to seek for knowledge. Now, you have a situation whereby majority of illnesses, not only cancer, is being reported to the hospital very late. And in some instances, it's at the terminal stage that people do go to the hospital. You have this, false belief that if you have a tumor and you go to the hospital and they said it's cancer, even before you go to the hospital, they will tell you in the locality that it is cancer. And that when you go to the hospital, the ultimate result would be for you to die because they are going to give you injection. You have a situation whereby there is no way you can have a better outcome at the end of the day. When you look at the African setting now, the incidence of breast cancer, for example, you have 3 countries that are leading, Mauritius being number 1. You have Nigeria following Mauritius, and you have Egypt followed by others. Now, it will surprise you to know that even though Mauritius is number 1 in the number of cases of breast cancer, Nigeria still stands as the highest in terms of mortality, in terms of people dying from breast cancer. Now, that will translate to the advocate that there is lack of awareness and there is lack of access to healthcare facilities. That is what is leading people to, either not go to the hospital at all or go to the hospital at very late stages of cancer, thereby, making the outcome to be not too positive in this sense. So in Nigeria, we have a situation whereby there is what I call the 3 golden A's. When any of the 3 golden A's is lacking, you have a myriad of challenges that will be between the patient and a better outcome. These 3 A's are: 1, availability. You come to the typical African society, and in this context, using Nigeria as an example, you discover that the availability of health facilities that can screen breast cancers and other cancers is practically not there. Where it is available, the workload on the people working in that facility will be so enormous to the extent that they consider awareness and education on the self-breast examination and other forms of early cancer screenings as, at the background. Thereby, you have unavailability of the facilities, unavailability of the experts, and of course, the second A being the accessibility. Now, if you don't have the facilities around, accessing the facilities also becomes a problem, particularly in all these our remote areas, So people don't, consider it so important to travel a very long distance to go and seek for care. Why? Because the facility is not easily available. And even if you go to that long distance, there is still no guarantee that you will get what you need or what you are supposed to get. Now, the third one, which is the most important one in this context, is the issue of affordability. A greater percentage of Nigerians, it will surprise you to know that about over 76% of Nigerians, for example, are seeking healthcare out of pocket, what we call out of pocket expenses. Now, when a larger percentage of the population pays for healthcare, and with the very large, very high level of poverty in the land, you can only imagine the kind of outcomes that you will have. And this is the reason why, to us in the Nigerian cancer advocacy space, universal health coverage is the only way whereby government can introduce, health care to all and sundry, regardless of whether you are a civil servant or a farmer, or whether adult or a child. Universal health coverage gives access to health care for everybody. And of course, it is a primary responsibility of government. When you look at the National Health Insurance Scheme, that has very minimal coverage, about 8% or so of the entire population of Nigeria, for example, a nation that has a projected population of over 200 million. And you have less than 8% of that population being covered by the National Health Insurance Scheme. And even at that, cancer is not adequately covered, you know. So you have a situation whereby it becomes a vicious cycle. You know, the equation, the situation will not change until when we wake up, until when government wakes up to its responsibility. With the passage of the National Health Act, at least we are getting somewhere now, because it is now mandatory that all states should institute or should have a state contributory health scheme in place, whereby all the workers of the local governments, the workers under the state governments should be enrolled into the health insurance scheme. And one thing the politicians are always forgetting is the fact that whenever there is a contributory health insurance scheme, the target, the main attention should not be on the civil servants. The main attention should be on the informal sector, where you have, you know, the farmers, the market women, you know, coming together to create that pool of resources to serve as insurance, so that that pool of resources can be created whereby patients can access care. Unless we try to think along the line of universal health coverage, the health indices that are very, very poor at the moment will not change. And it is unfortunate that breast cancer, being a curable cancer, we still have women dying from breast cancer every day. And it is a situation that will not change until we wake up. But for us, from the advocacy side, we are not going to relent. We will continue to fight. We will continue to create that necessary awareness. And our partner organizations have been doing a great deal of awareness creation. And you know, they said education is key. Education is the weapon. Once you are educated, then you are armed with the knowledge to have a very good health-seeking behavior, and of course try to avoid simple issues like safe breast examination that a woman can do, you know, from time to time. And once you know the normal, the abnormal can easily be detected. Whatever, you know, there is any abnormality in the texture or in the, you know, the kind of nodular appearance, no matter how little it is, when you are used to self-examining your breast, it will be very easy for you to identify. So, but we remain optimistic that the narrative will change and that the policymakers will listen to us so that the needful can be done in order to change the course of this negative narrative of poor indices in women coming down with breast cancer. Thank you very much.
Thank you, Dr. Umar. And what you shared briefly about what the Nigerian Cancer Society is doing is the perfect segue for my question. So although the month of October gives us this chance to amplify this conversation around breast cancer care and awareness, you know, and education of the risk factors, it is beyond just an annual commemoration. All year round, healthcare providers in the cancer space specifically are working tirelessly to improve the outcomes. Would you kindly shed some light, some insight into the Nigeria Cancer Society's work in specifics in coordinating efforts to strengthen the delivery of cancer care and what the roadmap currently looks like?
Well, thank you very much. Like I said at the beginning of this discussion, the Nigerian Cancer Society was established on the 12th day of October in the year 1968 at the University College Hospital, Ibadan. And it was established as a pillar for research as a pillar for awareness creation, as a pillar for engaging government policymakers on creating policies that will guide research, training, and treatment in cancer here in Nigeria. Now, this is 53 years of the existence of the Nigerian Cancer Society. And a lot has been done in order to sustain the effort of the society in, coordinating and monitoring and proper engagement of the right, individuals, government, in the quest for a better, budgetary provision for healthcare, budgetary provision for cancer, adequate care for all forms of cancers in Nigeria. Now, we have our partner organizations across the country. And for any keen watcher of the social media space or the local television stations, one can testify that the month of October has been full of activities, truly loaded with activities. And don't forget that we in the Nigerian cancer space, we don't, through October is Pink October, Breast Cancer Awareness Month. But every opportunity for us, like I said in February this year, during the commemoration of the World Cancer Day, I said to us in the Nigerian cancer space, every day is World Cancer Day. The same way, every month to us is breast awareness, it's Cancer Awareness Month, not necessarily breast cancer alone, because we look at the entire, architecture of the multiplicity of cancers, cancers generally, over 200 entities, so it's not just one disease. Anything can become cancer. So we capitalize on this opportunity of the Breast Cancer Awareness Month to create massive awareness on breast cancers generally, on cancers generally. Now, activities have been ongoing and our partner organizations have been up and doing. Now, it will interest you to know that by the end of October, there is what we call the International Cancer Week that was established some years back, an avenue where stakeholders in the Nigerian cancer space and from the diaspora, researchers, advocates, policymakers converge to discuss the progresses made, to discuss the challenges, and build consensus around the next steps. That event is coming up this year by the last week of October in Abuja. And it promises to be a gathering whereby all of us will converge. The First Ladies Against Cancer, a group of First Ladies working towards around cancer in Nigeria, will have a symposium there. Researchers will come and present their scientific papers. The Nigerian Cancer Society family, the partner organizations, over 50 registered partner organizations that we have now, will come together in collaboration with other government agencies like the National Health Insurance Scheme, the National Primary Healthcare Development Agency, the Federal Ministry of Health, will come together on a round table to discuss the prospects, to discuss the successes, to discuss the challenges, and discuss the way forward in terms of cancer advocacy and cancer care is concerned. And the Nigerian Cancer Society is at the forefront of all these advocacy campaigns. And we have been consistent, in calling for, improved budgetary provision for health. Of recent, we have been making a lot of noise because when we look at the budgetary allocation to the health sector, there was a slight improvement from last year, but the improvement to us is negligible in the sense that you have a situation whereby Nigeria and other African countries have signed very long time ago to commit 15%, at least 15%, it can be 20, of the consolidated budget to health. But unfortunately, we're in a situation whereby we are still operating below 5% of the total consolidated budget for health. But the reality is that we can do better, and we'll continue to amplify our voices. Just last night, I was at a function where a lot of dignitaries, a lot of government personalities were in attendance. The wife of the Vice President of the Federal Republic of Nigeria was there. 2 governors were there. And I made the same plea. I made the same call. I asked the organizers of the program to also intensify the effort. Let's continue to make the noise. Let's reach a consensus on what will be our guiding principle in terms of engaging policymakers. Because the more noise we make, the more voices that we make, the more they listen to us. And by the grace and power of God, that day will come when we will have a very, impressive budgetary provision. The Chairman House Committee on Healthcare Services, Honorable Dr. Yusuf Tonko Sununu, was equally at the program yesterday. And he informed the gathering that the Cancer Health Fund that is about to commence, when implementation about to commence. He said if there is 1 billion naira now, in this year's budget, they have also included money that before the end of the administration of this administration, we may be thinking of having billions of naira, not millions, in the cancer budget. And we said amen to that. And we remain optimistic that that will happen during our time. So we are doing a lot, and the momentum is very high, and we are not going to relent in intensifying the effort towards coordination, intensifying our efforts towards, coming together to have an umbrella where we can make a common voice, where we can make a common statement, where whoever is responsible will have to listen, because we are talking from an informed position, we are talking from a concerned position, we are talking from an advantaged position of advocates who are doing everything they do for the sake of humanity. And by the grace of God, we will get there one day.
This is commendable, Dr. Umar. Thank you very much for the insights you just shared on the work that's ongoing and what the possibilities that lie ahead. Well done. Like you spoke earlier when you mentioned about how education is very critical to, awareness campaigns, very critical to health-seeking behavior, to people knowing what to do, to just impact the incidence of breast cancer cases. I have a question in that line. So every year we know that awareness campaigns are launched or driven. What are your thoughts around where we are right now and where we need to be in light of these existing realities in mortality rates? And I'm asking this because breast cancer care is quite an aspect of healthcare that is sensitive, particularly culturally. So how do we ensure that our campaigns are impactful and able to resonate amongst women in a way that addresses, the limitations of reservations, those myths and misconceptions, as well as triggers action across both rural and urban communities?
Yes, thank you very much. You see, the reason why we cannot say we have not achieved much is so that we can be encouraged to do more on what we are doing. We cannot say we have reached a stage whereby we have recorded massive success, but we can equally say that we are making impact and we are making a positive, motion forward. Now, when you talk about awareness creation, when you talk about trying to demystify the myths and misconceptions, particularly in our rural communities, I would say that we have achieved tremendously in that perspective. If I should give you few examples, there are cancer advocates that are heading organizations that are survivors themselves. We call them champions. Anybody that survived cancer, we call them champions. Now, these champions are championing because of cancer advocacy in the localities. You have them across the federation. You have them as part of our state branches of the Nigerian Cancer Society, and you have them heading organizations. And particularly in this very month of Breast Cancer Awareness Month, they have had, or they are still having plans to conduct, series of awareness campaigns that targets the local populace. You see, the problem with lack of education is that what you don't know, if you don't know, you think you know. But when it comes to light, that this is the simple fact, and it occurs to you that you don't know, then you have that sense of belonging, that you are happy, you are comfortable, that people are coming to inform you of what you need to do to have a very, positive attitude to your health-seeking behavior. Ordinarily, creating massive awareness on safe breast examination will go a long way, in preventing breast cancers, because our target is prevention. If you can prevent, because prevention being the ladder to early detection. And, most cancers are preventable. About 60% of most cancers are preventable, if detected early. And so prevention is the key. And prevention, awareness creation is what will lead to prevention. And sincerely speaking, our partner NGOs, our partner organizations are working around the clock to educate the populace, to go to the nooks and crannies and educate the populace. Our researchers, who are professionals in their fields, are equally engaging in research to assess those women, particularly those women that come to them to seek for medical attention, to know what they know about issues like breast cancer, issues like other forms of cancer, cervical and what have you. And of course, build upon that to follow up and make sure that they educate, make sure that they monitor, so that an educated mind, is an empowered mind. And that person will go back to the society to preach, will go back to the society to inculcate, Another mistake, another myth that people have is that only women have breast cancer. It's not only women that have breast cancer, even though very negligible, about 1% of men also develop breast cancer. So the awareness is not only to the women, the men too are affected, because that 1%, you can be that 1%. So it means you have to also know what to do at the right time. So truly, we are having a synergistic approach at creating awareness that will change the narrative of cancer advocacy in the country.
Wonderful. I particularly like the insight that points to the fact that every one person, in their sphere of influence or their circle, can influence, can trigger, education about breast cancer care and just general awareness. So it means that everyone has a role to play. And I'm hopeful that this conversation will trigger that chain of reaction. You've been speaking particularly about early detection being the bedrock for prevention. What are your thoughts on how we can begin to reimagine, the introduction of care that addresses this challenge of late presentation, particularly from the point of care for young women or adolescents? How can we begin to reimagine introduction of care?
Well, you see, the bottom line to early detection is awareness. If you are not informed, you don't even know when to go to the hospital, when to seek for care, or you don't know the abnormal from the normal. There is no way you can have an idea whether you have, a small nodule that is benign, or it's just a fatty tissue that will dissolve the next day. You need to know for you to be able to know how to seek for care. And that is the reason why education is key. Now, just yesterday, I was in Abuja for the launching of a one-day seminar that we had. There is a foundation in Australia that is equally registered in Nigeria, and of course registered with the Nigerian Cancer Society, the OCI Foundation, founded by a professor of family medicine at Griffith University in Australia. Now, this foundation has been doing a lot of empowerment, touching lives, especially across secondary schools in Anambra State. Now, they came up with a concept they called Arm Our Youth. This Arm Our Youth campaign is a strategy to create education, to create awareness that will cascade down across all the strata of the human society. Now, they entered into partnership with the Nigerian Cancer Society and the National Youth Service Corps, the NYSC. Now, yesterday we had a one-day seminar in Abuja to sensitize one staff of the NYSC from each of the 36 states of the Federation and the FCT, 37, plus some core key component staff of the NYSC in Abuja. Now, the one-day sensitization training that we had yesterday will open a pathway for them to be trained online on how to go about propagating that campaign. Now, for us in the Nigerian Cancer Society, with our state branches across the nation, we have a liaison officer in each of the states that will liaise with the NYSC orientation camps during the NYSC orientation camps. Now, the idea is to teach these corpers the basic tenets of anti-breast and anti-cervical cancer strategies, to teach them how to prevent cervical and breast cancer, the tips on prevention. Now, by the time they are armed, they now are posted to secondary schools for them to teach. And of course, in the line of teaching, they will in turn, translate that message across to their students. The OCI Foundation is in partnership with the National Orientation Agency. The Ministry of Education is already in talks with this partnership to see how we can infuse this ideology of Arm Our Youth into the curriculum of education in Nigeria, so that in the coming years, we can even have a course on breast and cervical cancer awareness, things that will have a multiplier effect, in the society. That is the only way we can get out of the situation we are in. I'm bringing this to limelight because, without education, without cascading the methodology of 1 to teach 10, we cannot achieve the desired result. Not everybody watches television in Nigeria. Not everybody watches the news. Not everybody has Android phones that can access the social media. So we need one-on-one contact. We need one-on-one, engagement in order to educate. And the only way we can do that is by liaising with institutional, agencies of government, like the ministries of education, the First Ladies Against Cancer, with what they are doing at the grassroots, the National Orientation Agency that has presence in every nook and cranny of this country, same way the NYSC. And by the grace and power of God, in the coming years, that time will come when we'll be looking back to say, we have recorded massive gains, massive achievements in terms of awareness creation, because an informed mind is a wise mind. An informed mind will seek, early care whenever there is a problem. And of course, prevention, they say, is better, safer, and cheaper than cure. In fact, it has been scientifically proven that prevention is better than cure. So if you can empower the soul on how to avoid a calamity, why wait? We continue to empower our youth. We continue to empower our agents of awareness creation to continue to do the needful, so that in the coming years, there will be change in the narrative of the incidence of breast cancer and other forms of cancers in Nigeria.
Thank you, Dr. Umar. It's very enlightening. It's quite an eye-opener to see how much work is going on in this regard, and the potential for more. I'd like to ask, while we know that most healthcare providers want to provide the best services to the communities they serve, there are often constraints. Can we speak briefly about some of these constraints and how healthcare workers can be equipped in the delivery of patient-centered care?
Sorry, come again. Constraints as regards to...
constraints that healthcare workers face and how they can be equipped to provide patient-centered care.
Oh, well, yes. This still boils down to what I spoke to earlier regarding availability of health infrastructure, regarding welfare of the health workers, regarding the availability of the health workers, and these are major challenges we face in Nigeria. And of course, that may be the replication of what is happening across Africa, So we have a situation whereby the health infrastructure is at, it has reached a stage of, perpetual decay, beyond, the imagination of those of us that are optimistic that the system will change. Government is not serious in the building infrastructure for health. Government is not serious in investing for healthcare. And this is the replication of what is happening across Africa. It's not only Nigeria. I was privileged to present a paper during a conference on breast cancer about a week ago, Medland Hospital in Zambia. And to my surprise, the presenters from that country and another presenter from Kenya was still giving the same storyline. So I said, it means it's not only Nigeria. This thing is everywhere in Africa. Now, unless and only if we stand up to commit resources, to commit that political will to change the course we have taken so far, we will still continue to move in cycles. If you have been monitoring of recent in Nigeria, the rapid or the massive brain drain, you have people going for interviews in Abuja to go to Saudi Arabia and other countries to practice. You have a lot of professionals, trained professionals. Look at our oncologists, the cancer specialists in Nigeria. Where are we? We are at a very low level of, the paucity, the number of oncologists we have in Nigeria is nothing to write home about. And on top of that, some of these oncologists are still going out for greener pasture. So now government has to up its game in taking after the welfare of these professionals. Government has to develop the infrastructure so that the right equipment facilities will be available for these professionals to practice. And again, government needs to invest in the latest, technologies that are out there for cancer care. And of course, increase in budget to health is the bedrock. An introduction of the National Health Insurance Scheme to cover everybody. Universal health coverage is the only way we can be assured that people will have, access to cancer care. But the reality is we are still not anywhere in terms of the challenges healthcare workers face, in managing cancers, breast cancer inclusive. And remind you, the management of cancer is a whole, the management of cancer is a, the management of cancer is a whole concept of, multi-dimensional teamwork approach. It's not just the oncologist. You have the oncology nurses, you have the oncology pharmacists, you have the palliative care workers, you have the psychologists. So it's a teamwork. It's a multidisciplinary teamwork approach. Now, if you don't have the right, resources, if you don't have the right human resources, that becomes a problem in its entirety. So, but we remain optimistic that things will continue to change, but the challenges are enormous.
Thank you, Dr. Umar, for sharing that insight. So far, you've made quite the case for empowering women to make informed choices, regarding breast health and the need for efficient resources, support groups to navigate the diagnosis, the treatment, and even the survival. I'd like to ask, how can we galvanize actors at every state, from the private sector to the government, to fund breast cancer research, awareness, and treatment programs? And I ask this because in the last year, the Global Cancer Observatory recorded that the number of new breast cancer cases in females of all ages, amounted to a concerning 38.7%. So I'm thinking, what's the best way, practical actions or steps that everyone can contribute to making sure that, we are galvanizing action around funding, research, awareness, treatment programs, support groups, for all that has to do with breast cancer care?
Yes, you see, when you look at what happened to COVID, you look at the way the private sector galvanized and pooled resources for COVID. What did they call it?
I think there was a private sector alliance, I think.
Private sector alliance, something like that. They raised over 100 billion naira for COVID. Mm-hmm. Now, if the private sector can do that overnight for COVID, why can't same be done for cancer? You go to Lagos, you have state-of-the-art cancer centers being erected, being equipped by private individuals. If the people there can do that, why can't that be replicated across the nation? This is the reason why I salute the BUA owner, the BUA company that donated 1 billion naira or so to Kwara state government to construct a standard world-class cancer center in the state. This is a private entity, this is a private individual coming to the aid of the local population. Of course, building a state-of-the-art cancer center in Kwara State will benefit not only Kwarans, but the entire Nigeria. And same can be done. The Dangotes that are out there, the Otedolas that are out there. Even yesterday when I was having an interview with one of the television stations, I said, let private individuals come out and invest in cancer. Let us try to chase this monster out. Now, you have states like Kebbi, The governor of Kebbi State has done something remarkably very well for cancer. The policy documents that are at the level of the Ministry of Health in Abuja that is meant to serve as the national benchmark. These have all been domesticated in Kebbi State. You know, Kebbi State, as we speak, has a replica of the Indigent Cancer Fund that is operational at the national health level, the Cancer Health Fund, where indigent patients that don't have the means, cancer treatment is very expensive.
Yeah.
And not just everybody can afford to treat cancer. Somebody that is living below the poverty line, already living below $1 a day, and you are telling that person to cough out, millions in chemotherapy, radiotherapy, and what have you, is basically impossible. So when you have an institution that will provide free access to this kind of patients, and that is what is obtainable in Kebbi State. In Kano State, they have instituted what we call the social health insurance trust or something like that for cancer. A certain amount of money, and individuals were also asked to donate to that fund, so that can cater for people to benefit, that can cater for people to benefit who cannot afford to treat cancer on their own. So sincerely speaking, we will continue to call on private sector because we cannot all rely on government. Government is doing its bit, but those that have the means and the will must equally chip in, must equally come in to try so as we can salvage the situation, so that we can create a template whereby, the treatment modalities will be available and will be affordable to the local population. It's doable. It has been done for COVID, and I'm sure it can be done for cancer. And already some big private companies are doing that. The companies like BUA, and of course, it's doable. It can be done.
Wonderful. Thank you, Dr. Umar. This has been quite an interesting conversation. Our time is fast spent. We have a question from Aruna Tata. Thank you very much for sending in this question, who says, we really appreciate the capacity and effort towards the prevention of cancer, of campaigns of cancer in society and nation at large. I beg your pardon. What is the appropriate prevention for breast cancer? And would you just briefly just touch on this, Dr. Umar?
Okay, prevention for breast cancer.
Yes.
You see, the bedrock of prevention for breast cancer is,
early detection.
Not really early detection. For example, the safe breast examination that is very simple, that is straightforward, that a woman can do while taking a shower.
Mm-hmm.
And you take shower at least once every day. Now, if you know how to examine your breast, all the quadrants, and you know what the normal feels, it's very easy. And most breast cancers starts from benign stages. They start from a small nodule that is painless, that is benign, that is not cancer, that at that stage, if they removing that benign, this thing will eliminate the progression. So if a woman knows her normal, it's very easy for her to know the abnormal. And then of course, regular health seeking behavior, regular medical checks. When a woman goes to her doctor, her gynecologist, to have proper examination for cervical cancer, to also have the breast examination done. There is this advice that whenever you go to your doctor, your family physician, especially for those that are outside the shores of Nigeria, where healthcare, you have to pay for everything, that anytime you go to the doctor, don't go without examining your breast. So prevention is better than cure. And how do you prevent? You have to be, educated on the concept of how to prevent. There are millions of pamphlets going around. Various organizations are producing pamphlets. Of recent, we distributed pamphlets given to us by the Medical Women Association of Nigeria that are doing very well in terms of creating advocacy for breast cancer. We took them to our local NGOs in Yobe, and we shared them across, some in Hausa, some in English, but the unfortunate thing is not everybody can read. So, but still, the core advocates that are going around, like there is a cancer advocate, a survivor herself, a breast cancer survivor, that is organizing a cancer walk in Damaturu, the Yobe State capital, this coming weekend. And of course, people are indicating interest to come from the villages, from the localities, and anybody that comes will have one or two knowledge to go back to the society, to his local society, and cascade the knowledge. And of course, a time will come when this advocate will now be empowered to say, okay, let's go to this particular locality and preach to the women there and tell them what they need to do. But above all, particularly in our contextual, complex African society, especially for us here over the northern part of Nigeria, the support of the husbands is very important. Most women have issues because of the lack of support from their husbands. Sometimes to even allow the woman to go to the hospital to seek care is a major issue. And that is why we have to encourage the men to support their wives, to support their daughters, to seek for proper medical care as at when due. And that is the only way we can reduce the impact of breast cancer and other forms of cancers from ravaging our women.
Thank you, Dr. Omar. I think that there was something you mentioned that I would just like to quickly highlight because it resonated very strongly about how, and it kind of points back to one of the questions we had, addressed earlier about how we can create campaigns that impact, or that trigger action even in the rural areas. And what you just spoke about, indigent communication in local languages, is a very practical solution that we need to do more about, to make sure that this knowledge, this information is communicated far and wide. Thank you very much. Our last question is, we've spoken so extensively on things we can do, the collective responsibility of the government, the private sector, and all the stakeholders really. But I just want us to leave this session with each person having a takeaway. And I'd like you to please just share 1-2 practical public health strategies that everyone in the healthcare sector can play a part in to foster increased interventions for breast cancer care. Just 1-2 very practical tips that everyone can leave this session with.
Well, thank you very much. Before I say the simple things that all of us, regardless of whether you are a doctor, whether you are a nurse, whether you are a politician, whether you are anything, regardless of whoever you are, what we need to do in order to advance the cause of cancer advocacy. Let me say it that breast cancer is given a great deal of priority in Nigeria and in Africa, alongside cervical cancer and prostate cancer in men, because these 3 cancers are the commonest cancers that are killing our women and men, are the 3 most commonest cancers that constitute a larger percentage of all the cancers we have in Nigeria and Africa. Hence, the need for us all to be vigilant, to be proactive in terms of awareness creation, because awareness creation is not only meant for the healthcare personnel. We tag everybody that has the interest of, cancer prevention and early detection as a professional, because as an advocate, you are a professional in your own right. Now, the public health intervention that we all can offer is to do the little we can, no matter how little it may be, in cascading the knowledge, in telling the world what we believe should be the key word, which is prevention. Prevention, prevention, prevention. Now, to prevent, you need to know. So the little knowledge you have, don't hide it. Don't think you don't have enough to say. Encourage and pass the message across. Let other people know and also pass the message across. By that, we will create a cascade of events that will culminate in proper awareness creation in our societies. You can start from your home. You can start from your village square. You can start from your town, or you can start from yourself by educating yourself, by going for your regular medical checkups, so that you can advance the cause of prevention in cancer care, with particular relevance to breast cancer.
Thank you, Dr. Umar. One saying goes this way: one good act, when multiplied by millions, can transform the world. So each person has a role to play in influencing another, and on it goes. Thank you very much, Dr. Umar, for the remarkable insights you've shared. And as we've noted, this is a leading public health concern for women, not just in Nigeria, but across the globe. So we cannot stop in highlighting the conversation and the role everyone has to play. This has indeed been wonderful, and I believe that it has provided several takeaways for everyone, regardless of your role in the healthcare sector. We hope that everyone leaves this session with a renewed set of commitments to learning and exploring new ways they can contribute to improving the outcomes for breast cancer care. Thank you once again, Dr. Umar. Thank you to our esteemed audience.
Somebody was asking why other states are not doing what KB is doing.
Oh, I missed that.
And this is, yes, that is why I said KB, Kano, Ondo, Ekiti, Niger, they are all following suit and they are doing very well. What we need is an institution whereby even if you leave office today as governor, that institution will continue to be there and people will continue to benefit. And this is what we need to see across all the states of the Federation in Nigeria.
Notable. Thank you for catching that. Dr. Oge, my apologies. Thank you for sending in that question. And thank you, Dr. Umar, for responding to it. So thank you once more, everyone, for joining us today. It's been a very remarkable time of learning. We would like to encourage us, as Dr. Umar has shared, to keep the conversations going. If you have further questions, please engage with us via social media, and we'll be happy to address it. Thank you for joining us. Please join us at our next webinar. We appreciate you, Dr. Umar. Have a wonderful evening, everyone. Thank you
very much, everyone. Thank you. Thank you for having me.